Hi, welcome and good evening. Welcome to our live Facebook event. My name is Dr. Jeffrey Anna Marino. I'm a board-certified plastic surgeon at Bellissimo Plastic Surgery and Medispa, located in the greater Pittsburgh area. My practice has been doing monthly live Facebook for the past year, and we found it to be an extremely important tool in educating our patients and potential patients to different topics in plastic surgery. Tonight's a really special night for us. We are so thrilled. We are partnering with the American Society of Plastic Surgery and helping them kick off their very first live Facebook event. Our topic tonight is how to do your homework in choosing your qualified plastic surgeon. This is a very big and important topic. We're going to give you a lot of information tonight. We're also going to help you meander through all of this by giving you different tools to use, and so helping you choose that surgeon that's just specific for you. Before we get to all of that, I thought I'd give you a little bit of background of myself so that you understand where I'm coming from and my training. I did my undergraduate training at Pepperdine University in Malibu, California. I then went out to Creighton University in Omaha, Nebraska and finished my medical degree. I then circled back home to California and trained in general surgery and plastic surgery at the University of Southern California. I graduated in 2001 from USC in plastic surgery. At that time, I stayed on as an assistant clinical professor in plastic surgery and burn surgery, and also split my time with my private practice in Santa Monica. In about 2006, I stepped away from the university so I can concentrate on building my private practice. And in 2007, my wife Ella and I decided to move our family to the greater Pittsburgh area as our children were reaching that school age years, and we thought this would be a good place to raise our kids, educate them, and start a new practice. My practice now is really a consistent or a blend of cosmetic surgery and insurance-based or reconstructive surgery. We do everything from breast reconstruction, reconstruction after weight loss, aesthetic surgeries, and wound care. I also do some burn reconstruction still. So it's a real privilege to be part of this tonight to help bring this to you. I'm also a member of the American College of Surgeons. I'm also a member of the American Society of Plastic Surgery, American Society of Aesthetic Plastic Surgery. I've been recently appointed to the advisory panel and speaking bureau for Allergan Medical Aesthetics. So I have a wealth of knowledge, and I hope that you participate. I hope that we can bring some of this information to you, and so I hope you stay tuned. And please feel free to type in any questions that you have so we can help you meander through all of this. Our usual process is that my wife Ella is the moderator for the Facebook Live. She'll be asking me the questions and kind of taking us through it. She'll also field the questions that you type in. So with that, I want to kick it off to Ella, and we can start working through the process.
What made you decide to get into the field of plastic surgery?
For me, I was very lucky or privileged that I met a plastic surgeon early on when I was in high school. Dr. Michael Nicoli is a board-certified plastic surgeon and the founder of Cosmetic Plastic Surgery in Newport Beach, California. For some reason, he took me under his wing and gave me my first insight to what plastic surgeons do and how they help people. Dr. Nicoli's become my mentor, and even to this day is my main mentor in plastic surgery. He inspired me so much that when I was a fourth-year medical student at Creighton, I took a rotation in plastic surgery, and that was my first exposure to the reconstructive side, the cleft lips and palates, burn surgery, extremity reconstruction, breast reconstruction. And then I was hooked, and I knew that at that point, the rest of my career, that's what I wanted to be.
What is the most rewarding thing about plastic surgery in your experience?
I think it's probably the same as most plastic surgeons would say. Having the knowledge base and the skill set that you can change a physical trait on a patient that profoundly positively impacts their self-image. And so for me, that's what is so electric about plastic surgery is having patients refine or increase their own self-image.
Kevin wants to know, what was your biggest challenge starting out with Bellissimo plastic surgery?
I think the biggest challenge is starting anything from scratch. So I had already been in private practices in California, moving out here, starting over. I think getting the awareness out there of who I was and what my credentials were, what my experience level was. So I think that was the hardest part, is getting patients back through the door that knew me or trusted me to be their surgeon.
At Bellissimo, you have a special section under patient resources you call a patient safety center. One of the things you include here is an important document titled Checklist for Comparing Plastic Surgeons for potential patients to use when weighing their surgical options. What do you have on this?
The nice thing about this checklist, as I said before, we're going to give you tools that help you kind of find out who would be your best surgeon. So we put together a checklist, and there are different categories, and we'll go through those, but there's different questions under each category that you should ask, or things that you need to find out about your surgeon or about the credentialing of your surgeon, the facility. So what you basically do is compare different surgeons amongst each other, and you just go through and you ask those questions and you make checks. And at the end of the day, once you work through that worksheet, that surgeon that has the most checks is probably your best match. So we try to take a lot of that, frustration and the confusion out of comparing surgeons. So part of that is, what's the credentials of your surgeon? What is the experience of your surgeon? How do you connect to your surgeon as a patient? Is there a lot of connectivity, or is there just no chemistry between you? What's the facility like that you're going to be doing your surgery in? Is it accredited? What about the anesthesia team? So all of these subjects are part of that checklist.
The first point on that checklist talks about if your surgeon is certified by the American Board of Plastic Surgery. Can you talk to us about the importance of this?
I can't stress this enough. This is the most important part of the checklist. To be board certified by plastic surgery is paramount to looking for a plastic surgeon. And I know that sounds a little crazy, but what a lot of patients or people don't realize is that doctors and surgeons across the way can be board certified in any subspecialty. So in other words, you could be board certified in plastic surgery, you could be board certified in anesthesia, you could be board certified in dermatology, board certified in gynecology. So you get the picture. None of those doctors are plastic surgeons, and they're not allowed to call themselves plastic surgeons. So there are doctors out there, and some of them are not trained in surgery of any kind, doing cosmetic surgery. And so the way that they call themselves is cosmetic surgeons or other kind of different names can be confusing to the public. What it means to be certified by the American Board of Plastic Surgery is very strict criteria. Number one, that person needs to have graduated from an accredited medical school. They had to have successfully completed a surgical training program, meaning that you had to do at least 6 years of surgical training, and at least three of those years had to be dedicated to plastic surgery. You had to pass a written exam. On passing that, you were allowed to sit for a 2-day oral examination. You have to be recertified every 10 years. You have to adhere to a strict code of ethics. So to be certified by the American Board of Plastic Surgery, to the patient, what that means is that person you are picking compared to all the other subspecialty certifications is that surgeon is trained in plastic surgery, not just for the procedure you're looking for, but any potential problems, any potential complications, how to treat those problems, how to treat the complications, how to avoid the complications. These are all things that we're trained to do. So it's not enough anymore to say to your potential surgeon, are you board certified? Because they could be board certified in emergency room medicine, and they can say, yes, I'm board certified. It needs to be specifically board certified in plastic surgery.
How does this differ then from a board certified cosmetic surgeon?
Again, the plastic surgery, that surgeon is a surgeon that's been trained only in surgery as a background, and then strictly in plastic surgery. Remember, a cosmetic surgeon is any other doctor. You don't know what their background is unless you ask. But it could be a dermatologist who is now doing facelifts. It could be a dentist. It could be and anesthesiologists. So the American Board of Medical Specialties is the governing board that is sort of the umbrella under which all the other board certifications sit. They have been allowing and setting up boards for subspecialties since 1934. So the American Board of Plastic Surgery is recognized by the American Board of Medical Specialties. The American Board of Medical Specialties does not recognize any board with the term cosmetic surgery in it. So it's not a recognized board by that governing body. So they're just not trained specifically in plastic surgery as a board certified plastic surgeon.
How has being a member of the ASPS been beneficial for you in your career?
Being part of this is paramount. The Society of Plastic Surgery has done a number of things. Number one, it creates a network amongst all of the board certified plastic surgeons. So it creates this community, this family that we're all connected across the country. So we have colleagues now across the country that are unified. We can call if we have questions. We're unified under that. Also, the society has also taken upon themselves to be the educator. There are programs, continuing education programs, there are national meetings, there are webinars, all so that board certified plastic surgeons have the opportunity to stay abreast of all of the new trends, any data that's coming out from a laboratory, studies, clinical studies, so it keeps us on the cutting edge. The other thing that it does, it's unifying, it is also disciplinary. So it monitors everything we do. It causes us as board certified plastic surgeons to adhere to a very strong code of ethics that we're treating patients in the right way. We are up to date on all of our technical abilities, that they're watching our marketing, that we are doing the right thing by patients. So it has unified us on 3 different levels. So it's paramount, and it's a real privilege to be part of them.
Another major point on your surgeon's checklist is the surgeon's experience with the procedure you are looking to have done. What is the best way for a patient to determine this about their surgeon?
I think the best way is just to flat out ask a surgeon, what's your experience with this procedure? How many have you done? Is this something you do weekly or monthly? How many have you done in your career? How many do you do in a year? Go to their website. You want to look at their before and after photos. Feel free to discuss that with them. Remember, this is you, it's your body. You have every right to ask any question that you want. Go to their review sites. See what other people are asking or saying about that surgeon. Now, you have to remember that sometimes those reviews are not authentic, so take it with a grain of salt. But if you use those reviews in comparison of everything else you're finding out about that surgeon, again, it's a tool to either guide you in the right direction, either with that surgeon or away from that surgeon. The other thing is, ask the surgeon to talk to some of their other patients who have undergone some of those procedures. So at Bellissimo, we have a program like that if patients want to talk to somebody, then we alert certain patients. The patients will call and talk to that patient. That patient may feel free to ask any questions that they want, and they don't have to ask me about it. So I think it's important, and every plastic surgeon should be able to do that for you.
Kevin writes, do you believe that digital marketing is important for private practices?
I think digital marketing is an incredible tool to any practice. Again, I think there are guidelines, and I think that you have to adhere to that strict code of integrity and a strict code of ethics, that what you put out there needs to be true. And sometimes some of the marketing techniques can sort of stretch the truth, but I think it's a valuable tool. It's a valuable tool in my practice.
There's a section on the checklist that talks about the safety in the operating room or the surgical facility. Can you talk about that a minute?
Yeah, again, this is extremely important, because not only does your doctor need to be accredited, but so does the facility. Is the surgeon operating out of a hospital? How about an ambulatory surgery center? Or are they being done in their office? Some people are having surgery done in dental offices. So you want to make sure that the facility that your surgery is being performed is accredited, and there's different accreditations. You can look at the ASPS website, you can look at our website to kind of guide you into that right direction. The other idea or the other point that I want to make that most people don't know is ask your surgeon or your potential surgeon, do they have hospital privileges to do those cosmetic procedures at a hospital? A board-certified plastic surgeon will have those privileges not only at a hospital but also at the ambulatory surgery center or in their office. If they do not have hospital privileges, then there might be some reckoning to you that maybe that surgeon isn't the right surgeon for you, or maybe they're not a plastic surgeon, because they do have to have those privileges.
Dr. I might mess this up, Weth would like to ask, can you address the significance of having a board-certified plastic surgeon treat non-surgically, Botox, Juvederm, etc.?
I think in the same light, I think that...
That's from Janine, not Dr. Weth. She just clarified that for
Okay.
me.
Well, Janine. I think that, again, plastic surgeons are the best set up to do that, to do Botox and Juvederm or dermal fillers, whether it's Restylane or any of the other ones. I think we understand the anatomy the best. I think that because we do a lot of facial surgery, I think we are better qualified to do it. However, there are good training programs, and I do think that there are some other specialties that are good to are trained to do it, as far as dermatology, and sometimes the ENT doctors do a good job as well.
How has having a friendly staff helped with your patients?
I think your staff is a reflection of you. Our staff has been carefully selected, and so they're a reflection of my personality and what we want to do here. I really want my patients to have an experience that they are taken care of. They're listened to, their goals, their expectations are listened to, and we try to provide that experience for them. My staff goes the extra mile as well. So I want every one of my patients to feel like they're my only patient, and so the staff needs to reflect that. Whether that's answering the phone, answering emails, doing the social media, all of that needs to be reflective, and as the surgeon, that you need to be in control of that.
As a surgeon, what do you think are the most important things for you to do for your patients, both before, during, and after their procedure?
I think that kind of goes back to a tenet we all learned in medical school. I think you need to listen to your patient before surgery. I think as I've gotten older, listening to what my patients, what their goals are and their expectations, and really aligning myself to where am I on the same page as that patient? Because not only is the patient selecting me, I have to select that patient. And sometimes if I'm not on the same page as the patient, I may not be the best surgeon for them. So my goal is to listen to what they're saying and really listen to it, and not have my preconceived ideas enter in, but be on the same page. So that I do that pre-operatively. Going through the surgery, we have to remember that as surgeons that we are also teachers, and we understand the process. Plus, it's very common for us. We do this every day. Your staff has to feel the same way. So sometimes patients don't understand that. They don't understand that the healing process takes several months to a year, that things are not overnight. And so I think sometimes we all get that expectation. We're going to come in, we're going to do some surgery, and in a few days you're going to feel better and be back to things. And so that can cause some undue anxiety with patients. And I think it's our job as a surgeon and as a physician that we educate them, hold their hand, walk them through it, and again, listen to what they're saying so that we can kind of quiet any anxiety that they might have.
I think that's really important to note, that patients, their anxiety is something that the surgeon doesn't always recognize because they've seen the long-term healing process. And so as the patient's going through the experience, it's important for the surgeon to recognize with each patient that it's a new process for them.
Right, and I think that's easy because, again, it becomes very routine for us as surgeons and as our staff who see the patients every day. You really have to keep to the forefront of your mind that for this patient, this may be the very first time they've had surgery. They have no idea what to expect from the anesthesia. They have no idea what to expect in the post-operative period. How much pain are they going to have? What are the incisions going to look like? When does it all finalize? When can they get back to activity? And even though you tell them that in the beginning and preoperatively, sometimes all that kind of goes out the window because now they're experiencing it every day. And it's that routine that we get so accustomed to. We really have to keep that in mind, that this is their first time, and educate each patient individually.
I know frequently I hear questions about potential complications and how the surgeon would treat those. Also, there's a lot of questions about revisions with surgery. Is this common, or is this something that's an unexpected result?
I think that in any plastic surgery, there's frequently reasons for revisions. And even in the best of hands, even in the best of conditions, patients need to understand that it's not like building a house where you're cutting wood and measuring. We're dealing with human tissue, and there is elastic properties or lack of elastic properties. There's healing, and there are scarring as part of that. So as things heal, patients need to understand that things may not heal as exactly like even the surgeon wants. So there may be some revisions in the future, and most of these are minor. Many of them can be taken care of in the office. But I think, again, being on the same page as your surgeon, and as a surgeon being on the same page as your patient, and updating them and being honest with them and taking them through it, I think it's understandable. Most patients are okay with it as long as we go through it together.
How do you find that patients have shaped your experience as a plastic surgeon?
I think I've been lucky as I've gone through this. I've been in practice now almost 17 years, and each year has been a better and better experience, because as I've been able to learn to grow with patients and understand what their goals are and their expectations, as I said earlier, I'm better now than I was a few years ago, being on the same page. So I want to make sure my patients know I'm walking with them hand in hand. We do this together. And so their experience becomes my experience. And when they're so delighted in what they see, it causes the same delight in me. And so you get to know everybody very, very closely. And in my practice, I see every patient at every visit. That's just the way I do it. It works for me. It makes the experience for me better. And I think my patients like it because I'm the one doing the surgery. If they have any questions or any concerns, then I'm the one that can answer the questions the best.
That makes for some busy office hours.
Yeah, my staff is prepared for them, but it's the only way I've ever done it, and I just don't see any reason to change that now.
Rachel asks, what do you have to do to become board certified?
Again, Rachel, you have to be certified by the American Board of Plastic Surgery. You have to graduate from an accredited medical school. You have to complete at least a 6-year surgical training from an accredited surgery program. 3 of those years have to be dedicated to plastic surgery. You have to pass a written exam, then pass a grueling 2-day oral exam. You have to undergo recertification every 10 years. And you have to adhere to strict ethical and integral policies set up by the American Board of Plastic Surgery. So that's how you have to do it. It's a grueling process, but it's definitely well worth it.
Do you find that offensive if a patient is interviewing you and asks you if you're board certified, or do they frequently ask you those questions?
They frequently do, but it's appalling that I don't think I get asked enough. Now maybe they see the diplomas on my wall and they can see the credentials on my wall, but I think everybody should ask those questions. Again, please, if you're listening, you shouldn't feel uncomfortable asking your surgeon any question that you want. And as a surgeon, I shouldn't feel uncomfortable answering any of those questions. So again, it helps you form that bond between surgeon and patient that you're on the same page. So no, I don't have any issues with that at all.
If you had to stress the importance of one point to consider when a patient is choosing a surgeon, what would it be?
We went through a long process now. I think to sum up what we've talked about tonight is you have to do your homework. No one can do it for you. We can give you this information. We can give you the tools like our checklist. You can go to the ASPS website, the plasticsurgery.org. They have a tremendous amount of tools and information to help you kind of navigate through these waters. But you have to do your own homework. It's your body, it's your life, it's your family. Some plastic surgery, for the most part, has very little complications. Done in the right hands, done in the right facility, done with the right anesthesia, your risk of having a bad outcome are very, very small. Your risk of having a great outcome are very, very high. So, but you have to bring that upon yourself. We can't do that for you. I try to give patients as much information as I can when they come to see me and answer all the questions, but you need to know that. You need to know what your downtime is. You need to know when you're going to get back to work, when you can be with your kids, when can you drive, all the logistic things, who needs to be home with you. These are all things that your surgeon should go over at the time of surgery, or somebody in their office should answer those questions for you. But you should feel comfortable asking them. So what we try to tell patients when they call for consultation is go to the website, look at our videos, look at our surgeon's checklist, go through those so that when you come in, you have out all the information that you want. You have every question you want answered. I'll spend as much time with any patient until all of their questions are answered. And there's no obligation. If they decide, listen, I don't want to do this because I found out information and it's not right for me, all the better. My biggest thing I tell patients, I would not want to have a patient go through surgery and then look at you and say, if I would have known this, if you'd have told me this prior, I never would have done it. That's not right. It's not a sell tactic. We're here as an educator. We're here to provide you the information about the procedure or about the concern that you have, and these are your goals. This is what we look at, or what I look at as a plastic surgeon. This is what I feel would be your best possible surgical solution, and then you decide what's best for you. And whether that's vetting it out with 2 or 3 other plastic surgeons, go ahead and do that. You should never feel uncomfortable asking for a second opinion, or a third, or a fourth. And any plastic surgeon that gets mad that you're going to do that, or any surgeon that gets mad, then they may not be the right patient or the right surgeon for you. And again, that goes back to our criteria. What's your connectivity with that doctor? What's the emotional attachment? And so I just want to say this to you. As you go through that checklist, the emotional connectivity with your surgeon is very important, but it isn't as important as every other thing that I talked about. The most important thing is your surgeon board certified. Is he doing your surgery at an accredited, or she doing your surgery at an accredited facility? Is there a board certified anesthesiologist or a certified anesthetist at the head of your bed? What's your post-op like? What's the office like? What's the staff like? And then, if all of those, when you're comparing 2 or 3 or 4 surgeons, and all of them add up and they all have the same amount of checks, at the very end, the person that you connect with emotionally is your surgeon. You should feel comfortable asking any question. You should feel comfortable calling them at 2 o'clock in the morning because you have a question about something, or you're worried about something. It's okay. You should feel comfortable doing that. And the surgeon that resonates with you is your surgeon. And it's frequent that I tell patients, listen, go for a second and third opinion. And at the end of the day, you're doing this for you. Choose the one that's the best qualified for you and that you connect with. If it's me, great. If it's not, that's okay. You need to feel comfortable with your surgeon. Not every surgeon is going to resonate with every patient that walks through the door.
Before we close, I just want to let people know, if they're interested in seeing how plastic surgeons are using big data and other technologies to help patients, check out the PRS Grand Rounds live lecture and Q&A on facebook.com, PRS Journal.
Yeah, I want to say the other thing that the the American Society of Plastic Surgery, they put out a monthly journal that has all the latest techniques, and that's where they describe the latest things that are going on in the lab, the newest technology, the latest breakthroughs. So this is a great opportunity to tune into that. You'll get a lot of information out of that. And remember, you can go to their website at plasticsurgery.org. You can go to our website at bellissimoplasticsurgery.com. I want to thank you for tuning in tonight. I hope it was helpful. The checklists are there. Anybody can get that and download that from our website. Stay tuned as we take over the ASPS Instagram account in the near future. Next week, for our usual followers locally, we are going to have our live Facebook coming to you, and we're going to be talking about mommy makeover procedures. So again, thank you so much. And again, it was thrilling that we were able to partner with the American Society of Plastic Surgery, and I hope this kicks them off into the right direction. Good night.